My name's Janice Smithaniuk, and I am a resident of White Rock. Grew up in Vancouver. I've lived here all my life. I am a retired high school teacher. 2016, November, I found a lump in my left breast and immediately went to my doctor. Had a mammogram, had an ultrasound, had a biopsy. I had malignancy. Because it was earlier stage, I was able to relax a little bit and make some decisions of what I was going to do. Went on the internet and located Dr. Gurham. I had heard her speak a couple of times a number of years prior, so I had a little sense of who she was. Went for a consultation with her. Immediately, I knew she was a good fit for me. I sensed confidence in her own personal confidence, knowledge, very good knowledge, very personable, very easy to talk to. She wants to know your history. She wants to know something about you beyond just your diagnosis. I started on an IV that same day, right after my consultation with Dr. Gurham. Started with vitamin C and an injection of mistletoe. I was going 3 times a week to get this treatment, and not until after my surgery did I start the hypothermia treatments, which were, I think, probably the key for dealing with the cancer cells. Also blood tests periodically, which I think are important to see the overall picture, not just of the cancer, but also how you're doing nutritionally. It's really personalized medicine. First of all, I think it's very important not to feel pressured into making a decision you're not comfortable with. I did quite a lot of research. I felt very strongly it had to be my decision. The person that's affected with cancer has to feel comfortable with what they're doing. I have chosen, I think, a great team of people to work with. Not just Dr. Gurham, but an oncologist as well. The oncologist that I ended up going to actually works sort of at arm's length with Dr. Gurham. He knows her well, she knows him well. It doesn't have to be an either or. It can be both. And most of the patients at Dr. Gurham's, I'd say well over 90%, probably more over 95%, are choosing to do both. And I think the sooner you can start the treatment such as Dr. Gurham offers, the better it is for your overall health, because she can help support your immune system while you're going through chemo and or radiation. She makes an effort to let them know what she's doing, like almost right away. When I was decided to be her patient, she sent a letter to my doctor and said, "This is what I'm doing with Janice, it's evidence-based." She was really upfront, and I like that about her. It was nothing to hide. She respects conventional medicine, but she's practicing more natural medicine. And so I appreciate that. I believe that the whole body is important. What I really like about Dr. Gurham is that she looks at you holistically, not just at the disease. I don't see it as killing something. I see it from the opposite, making myself well rather than killing something. It's more than the disease that's caused it, that's more than the disease that you need to deal with to get well again. And so she talks a lot about diet and your sleep, how important your sleep is, and your stress level. Exercise, Dr. Gurham talks about as well. So she's looking at the whole body and looking at getting you well on many levels instead of just containing the disease. The staff there is wonderful. They answer any questions. They're very knowledgeable, very capable, very caring. You see Dr. Gurham quite frequently. I've been going for over a year and a half, and the cancer treatment actually ended after about 8 months. I don't want to just sit back and wait and find out, oh, it's back and it's spread, or no, I'm good. I'm good. And so Dr. Gurham has tests that she can do, blood tests that can be done to determine the condition, cancer cells in your body and your overall health, and she accesses those a lot. I feel much more comfortable because then if there were to be cancer cells again, then okay, let's go back to treating the cancer. If you choose to do just conventional, great. If you choose to do this, great, but be on board with it, because I think that really makes a big difference. I feel great. I feel as good as what I guess I could expect to feel. It's just a really healing kind of environment. The scariest part is definitely over for now. I'm not suggesting that's the best route for anybody else. It was the best route for me. Dr. Gurr made going through this scary time a whole lot easier. I wouldn't hesitate to recommend it to anybody.